said, my name is Carrie, and I have only been with Multicare Home Health and Hospice for about 6 months now. But before that, I was with Franciscan. So I kind of know both of the key players in Kitsap County pretty well, and kind of the access and some of the difficulties we're currently having with access to hospice services. As many of you have probably, I don't know if you've heard kind of out in the world, besides in the healthcare industry, that nursing shortage has increased even more with COVID. We already had a nursing shortage. The shortage kind of increased with COVID, and to have hospice nurses, you can't just take somebody straight out of medical school because they're case managing very complex cases. So they have to have years of experience. So finding nurses has become a challenge across the board for all agencies right now. So I'll get a little bit more into kind of where that's headed once I get into these questions. I'm going to start with, you guys asked me, where are the clinics for primary adult health care located in Kitsap? We are not very outreached out in Kitsap as Multicare. We have one main clinic in Poulsbo that services some of your patients. We also have urgent cares through Indigo throughout Kitsap. But other than that, we really don't have a primary base care for any more of your patients. But we do in the hospice realm, we see people out of Virginia Mason Franciscan Health. We see people out of there is a Seattle Cancer Care Alliance. We see patients out of there. Just recently, I put on a patient that was at UW Medical Center in Seattle, but lived out in Kitsap County. So we kind of draw our referrals from all over, because people in Kitsap County a lot of times have to travel outside of Kitsap County to get care if they're not getting it at St. Michael's. A lot of times you'll see a lot of the heart patients, like CHF, congestive heart failure. Some of the more complex cases are being seen at Tacoma General with the Pulse Institute. So we also draw from there for Kitsap County. So accessibility within Kitsap County with us, like I said, is not big. I think the major player out there is going to be Virginia Franciscan Health for clinics. I was not able to find out the percent of patients that we serve in Kitsap County. I can say in the realm of hospice, we tend to, it kind of depends on our nursing availability, but we tend to have about 62 patients in Kitsap County that we have on service at one time. And I think we're in the aspect to grow that as we see the need for it. Obviously, we're seeing more baby boomers hit kind of that age range where we're going to need more care. So, potential growth down the road for us. One of the next question you asked was, what end of life services are available for your patients? Where are these services posted on the website? Nice thing is if anybody out there has the access to Google and they Google hospice services in Kitsap County, it's going to pop up every one that there is. We are up to 4 agencies that are able to practice in Kitsap County. You have us as Multicare, Franciscan, Virginia Mason. You have Kaiser. One thing with Kaiser that's to note is you have to have Kaiser insurance to work with Kaiser Hospice. And now you have kind of the new player that came into play, and that's Envision. And they are out of the 4, Virginia Mason, Franciscan Health, and Multicare are both nonprofit organizations. And Envision, and my understanding of Kaiser, is they are also for-profit. So you have 2 kind of for-profit, 2 nonprofit, which can sometimes affect hospice care. If you go on and you look at, there's a national website about hospice care. If you look at the differences between nonprofit and for-profit, they suggest you try to find a nonprofit in the realm of hospice care. So it's really easy. It's going to come up. And once you push on the Multicare site, it's really neat. I actually went and looked today myself, acting like I was a patient. So I didn't quite know what it had. It comes up and it's like it tells you exactly kind of down and dirty what our services are that we offer. A medical director that's going to follow the hospice realm. We have an RN case manager that's with that patient. We have the social work. We have the idea of a chaplain or spiritual service. Not something that every patient is going to want or elect, but it is there as a thing. Home health aid, comfort therapies, volunteer services, which we now have brought back into the realm. A lot of those were kind of on hold during COVID, but they're back, which is great to be able to have all that. And it does discuss all that. And some of the real concerns that are related to hospice are right on that page, right when you click on if you click in hospice services, it brings you into Multicare, but it brings you directly to the hospice page, which is really great. It's actually put together pretty well. It explains things really well. I had talked about how we don't have great accessibility throughout the area, because you asked the question of where do these patients find availability? Oh, I'm sorry, I'm losing my train of thought. I apologize. One of the other questions you asked is, how are patients and their families verbally informed of PSHS end-of-life services that are available and performed prior to admission? Most often, those referrals come from hospitals. We get a lot of referrals from St. Michael's over to Multicare. Clinics, especially oncology, hematology, we see a lot of them from there. It's usually the doctors are bringing it to the family and the patient's attention first. Very rare. There is circumstances that I've seen in the past where the family is really crying out, and I've had them call, and they're, looking up, like you said, they're Googling that hospice, they're getting a hold of us, and they're doing a self-referral. That is something that you can do in the realm of hospice. You can do a self-referral, but we do have to then contact the primary care doctor, and clinically justify that we can have them on hospice services, since this is covered through their Medicare benefit. Medicare, Medicaid, and most commercial insurances do offer a hospice benefit, but they can do a self-referral. And so, hospital is one place. Like I said, Seattle Cancer Care Alliance, always call it SCCA, but I don't know if a lot of people call it that. The primary care provider can also discuss this, and something that has kind of changed and shifted in the world of Medicare with primary care is they have actually now given primary care providers a chunk of time where they can discuss advanced care planning. It's kind of, it's kind of like your primary care visit that you get once a year through Medicare. They now have a section where they get to sit with Medicare age patients and discuss advanced care planning. And this is a time, a lot of times you'll see primary care providers bring up, obviously you're going to bring up your post form, some of the other advanced care planning. And I would suggest, if you guys want to learn more about advanced care planning, to speak and reach out to Honoring Choices. Honoring Choices discusses kind of all of that advanced care planning, and they actually are a great resource in the community for any of that. So a lot of that goes on, and then the primary care provider gets a real understanding of what the patient's wishes are, if they have a disease progress that might be terminal, or one that's just, that's going to continue to progress to a point where hospice is going to be appropriate. So that's another time now. And it's a great thing that Medicare has put that into place, that they can have those wishes kind of put in the forefront in the thought of families and patients' minds, maybe before it's time for hospice. That's our goal. That's my goal as an outreach coordinator. The reason I do what I do is I think a lot of times families hear the word hospice and they think it's for that last 7 days of life. And our goal is to change that and to give them the true benefits of hospice, which does not happen in the last 7 days of life, in my opinion. So that I am one of those people that I'm currently, when you talk about how do they find out about hospice, I am new to this position, but I'm trying to get out to all the assisted living facilities, get in contact with some of the clinics, skilled nursing facilities, get my face out there as a resource. To not only to get into, and I do these types of trainings where we're, a lot of times you have extreme turnover rate with caregivers, especially CNAs, and they don't really recognize what signs to look for that's showing that maybe a patient is ready for hospice. So, or that they're taken care of. So I try to do as much education in the community to try to put forward what constitutes a referral. Are they losing a lot of weight? Are they not swallowing anymore? Has their appetite gone down? Are falls increasing? Are hospitalizations increasing? The kind of some of those key signs that caregivers can look for. So that's kind of another thing that we're looking at as a way to get our name out there and understanding of hospice, so that families are informed of it before an admission or before crises hits these families. I love this one. Number 6 was, what questions would you recommend a proactive patient and or a family member ask regarding end of life health service policies? So there's, first thing I would say when it comes to if there's something that they're proactive about would be, you need to, right now, as I said, we have a nursing shortage. So people need to be asking these questions at the beginning of a diagnosis. Let's say a patient is being diagnosed with CHF. We know people live for years with congestive heart failure. People live for years with, COPD. Cancers, they're going to go through treatment. They need to start asking questions about hospice at the beginning. We need to get them started in the beginning, because if we wait till these families are in crisis mode, most of us hospice agencies are 7 days out for admissions right now. Yeah. And so if you're waiting till that crisis moment, then that pain is uncontrolled. A lot of times they're going to the hospital, and as you probably know, like, visitors in the hospital is next to nothing right now. We can't really have a lot of visitors during COVID. And so then they get stuck in the hospital by themselves. So I think my big thing would be, you need to talk to them about how long does it take to get a hospice agency out there? That'd be one thing. About policies, it's the pain management. So pain management in realm of hospice is very different than any other healthcare setting, due to the fact that since the opioid crisis has come along, there are very strict and stringent guidelines to be able to give pain management. And it's very different in the hospice realm. And so understanding the difference would be something that maybe a proactive family member might want to ask, is really that pain management key. Another thing would be, how do you deal with anxiety? A lot of times we see dementia, Alzheimer's patients, the anxiety kind of start to increase. So these would be some of the things that, if I was a family member asking about hospice, I would start with. And if we get them on earlier, we can get their symptom management under control. All their symptoms, their anxiety, their a lot of times the pain, which causes nausea, we get that under control, they're going to have a better quality life. And sometimes it actually prolongs life. So we can keep them alive longer because their pain's managed. They're not nauseous because their pain's managed. Their anxiety is lower. So they're enjoying their time with their family and their friends as they progress in their disease. I personally do not refer patients to hospice. I'm not a doctor. It has to be a provider, like I had stated. And I had talked about already where our referrals do come from. They do come from primary clinics sometime, but I would honestly say that's probably the smallest percentage of our referrals come from the primary care provider. And our largest definitely comes from hospitals, probably number 1. Hematology oncology is probably number 2 for where our referrals are coming from. And Franciscan has hematology oncology over there. You have Seattle Cancer Care Alliance in Kitsap. Am I mistaken? Is that it? I think you do work with Northwest Medical Specialist. I do know that we get referrals in that area from them, and they are a huge provider to us. And I am probably in constant contact with them daily. So those are your biggest places that most of our referrals are coming from. Are you aware, this was one, are you aware of differences between secular hospice services and non-secular hospice services? So I'm kind of curious if I could have maybe somebody come off and answer if you're wanting to talk about death with dignity here, or what you were kind of asking for here. I don't know if
I think it's mostly related to the death with dignity.
Okay.
And what people can do when they're on hospice, but in their home.
Okay. So death with dignity it's actually kind of a program in itself. Multicare does support death with dignity. So in the process, so they would have to, it's almost like they have to kind of go through the state. There's a strict and stringent guidelines. And one of the guidelines is you have to have 2 providers sign off on the death with dignity. At Multicare, we support it. Our providers will be one of the signing doctors with death with dignity. And we do allow our clinicians to make their own choices on if they want to be there for it, but we try to support the best we can with death with dignity. If you are looking at Franciscan Hospice, I can speak from my years there. They are a Catholic organization, so they don't necessarily support the process of death with dignity, but you can still be on services with them, have the full services of hospice with them, and you can do your death with dignity separate from their hospice services. So I think there's been a little misconception that they won't take anybody that's choosing death with dignity, but they do. It's just the clinicians cannot be present during the actual moment when they choose to do I guess, I don't know if you want to call it a comfort kit or the medication that they take that is related to death with dignity. So it is a little bit different. And as far as I know, like Envision and some of the other organizations, most likely probably do support it because they don't have that religious aspect kind of supporting their organization. So that's kind of the biggest thing with death with dignity. A lot of times they can ask questions of our clinicians, and usually they may come on hospice, and then we see people that know about it right away, and they kind of are working cohesively with the death with dignity and our hospice agency. Some ask the questions to our social workers when they start services. The process is actually kind of a long process, and we've seen people, kind of start the process and they just decide against it. So, and it's something that is very personal choice. So I talk a little bit about it, but it's, I don't really go too in depth because it's a very personal decision, and it's a very individual personal decision. So that's about all I get into on death with dignity. There is a website if you guys ever have any questions. And you can probably find somebody to also speak on that. It might be something interesting to have as part of your group. And then, are there services you do not provide in your facilities? So I did kind of touch on that. We do help with death with dignity. Also, we don't have a hospice house. So if a patient is in their home, remember that when we do hospice care, we do see them in their place that they call home, whether that be a home, an adult family home, a skilled nursing facility, assisted living facility. We do our hospice there. Mind you that during COVID, it's been a little more challenging. Some of these facilities have put some pretty strict restrictions as needed. So some of it has been limited services in some of those facilities, where they want just the nurse coming in and they don't want all that foot traffic, but we try to accommodate with Zoom and other ways that we can to try to, still try to give the full scope of services. But if they have uncontrolled pain, and they would need to most likely go to a hospital after talking to our nurse if they felt like they just couldn't control the pain. We don't see that very often. I think we just have wonderful providers that are able to keep them comfortable within their homes. So there's really kind of nothing that we don't really, that's related to end of life, that we don't try to address. Number 10, I've touched on this, and this is probably a big one that you guys will want to touch on, is if I'm aware of limited end-of-life health services in the general population in Kitsap County. Yes, it is very limited right now. We as an agency made a choice to do better care, so quality over quantity, meaning that we are trying to keep our nurses' caseloads a little lower, so that they are able to really touch those patients more than once a week. And then when they're transitioning to death, to be able to get there even more often. So, that's one reason for maybe a little bit of availability. Number 2, we've had some nurses kind of move on, kind of leave the field completely. Franciscan, same thing. They've kind of had some nurses kind of leave the field or go other places, and nurses that were close to retirement retired during COVID. understandably. So it is right now you're looking at usually on a bad week, seven day wait to get onto hospice care. I do know that we did one in Kitsap County and it took us 48 hours, which is our ultimate goal, is to be out there within 24 to 48 hours. But it changes daily based on census. So, somebody could call me today. I had somebody call me actually at the Ridge and they said, do you have availability? No, call back tomorrow. They called back the next day, we had availability. So it does change daily. And so it's kind of something that's why we really want those early referrals, so that we can really have the time to get out there and not put them in crisis mode. Since comprehensive end-of-life health services serve a particular population, how do I think the public can best be informed of these services and any limitations? Is it important that the general public be fully informed? Well, that's why I'm here. So that's my job, is this, to try to inform the public. Not only do I join industry-related networking groups, I have decided to reach out into local chambers and local business companies to really discuss what hospice brings to the table in order to try to get more people aware of it. It's just I'd say 85% of the families that I've talked to during the time that I've worked in hospice think that we're coming in the last 7 days of life and we're going to over medicate or, just medicate these patients to the point that they just, die. That's it. It's a very misconception. And the word hospice is a very scary word for so many people. So I think it's very important that we talk about it openly and really talk about the comprehensive services that hospice really is. In the realm of Medicare, hospice is the best benefit there is. It covers, not only does it cover your nurse, your social worker, your chaplain, your home health aide, which is, bathing and that type of stuff. It covers any medications related to the diagnoses. It covers all DME, so any type of durable medical equipment, hospital bed. If anybody ever has tried to get a hospital bed outside of the realm of hospice, it's next to impossible through Medicare. That's there when they need it. If they need a certain type of wheelchair because things are kind of shifting, that wheelchair will be brought out. It also includes personal care. So things like any of the care products that they need, Depends, anything like that, that's all covered under the hospice benefit. Anything that's related to the actual hospice diagnosis for medication. One thing also that people need to understand, that they cannot be seeking curative treatment. So, so everything is related to comfort over curative. That's about it that I have. I threw this together and answered question as quickly as I could because I got these questions yesterday. So I would love to be able to answer anything additional that you guys may have.
That's great. I had one other question, and I bet others have some questions too. Well, I have two actually, but I'll ask one now. One is, so you don't have a hospice house here in Kitsap. Is there one at all that you know of?
Franciscan has one in University Place.
Okay.
There's not a lot of hospice houses. A lot of times especially probably in Kitsap County, if they didn't choose to go to the hospice house, the other option, if the uncontrolled pain, would be to go to St. Michael's for friends, so they can go to the hospital. And some hospice agencies have contracts with skilled nursing facilities to be able to do the work in there. But I am unaware of that, and especially during the time of COVID. So yes, and really Franciscan and Evergreen, which is way up in Kirkland, are the only two that have standalone hospice hospice house in the area. So
wow. Yeah, I didn't think it was very common. We used to live in Yakima, and they created one over there while we were there. It's a wonderful facility, but I understand most hospice is done at home, and that I think is what most of us want.
Yeah.
But does anybody else have a question? Just go ahead.
But hospice house Franciscan is beautiful too. I will say that it's the work they do there. They make it feel like home. But I mean, home is still better. I mean, home is, and that's our goal. That's why I do what I do. I don't want my family member in a hospital dying. I want them home where they're comfortable with, surrounded by their family. So.
Mm-hmm. Go ahead and unmute, Pam.
This technology, you know.
It's not unmuting her. Let me try. There you go.
All right.
Okay.
My first question is, when you said you want to reach out to the medical community, I'm wondering if you have given a presentation to the Kitsap Medical Society.
I have not. I started with kind of the assisted living facilities, and especially since I don't know if you guys are aware that there was a new memory care that opened up on Bainbridge Island through Fieldstone? Through Fieldstone. I've met with the Bainbridge Island Senior Center with a group through them. So it's, you know, to be honest, it's still very, with COVID, it's been kind of like this for me to kind of get in and get deep with meetings. So yeah, and then I did Silverdale so far. So still very, very new. And I've never marketed to like Kitsap, and I've never done outreach to Kitsap until I started and really kind of started marketing the end of August. So I'm hoping, let's fingers crossed that COVID numbers stay low, because they are, you know, looking good right now in our state, and that I can get out there more and do stuff.
Because I was thinking we had a presentation from even the residency program through Virginia Mason. And, you know, primary care doctors really should be fully informed, as well as internal medicine. You know, what are the options? And my second question is there a difference between Virginia Mason's Franciscan and CHI on hospice and end of life service or access? Are there two different, or are they both all the same?
To get to them?
Well, to have referral to, for instance, to end of life, our presentations for Virginia Mason Franciscan sometimes doesn't seem the same as what we understand for Silverdale CHI. And are they two different Catholic situations or a system?
So my understanding, and you'll probably need to, I don't want to really quote them because I don't really work for them anymore, but my understanding is that if they were a Virginia Mason building before, they can follow a different set of guidelines than if they were a CHI Franciscan. I would definitely reach out to them. They're going to want to speak on that. But that was my understanding. So I'm not quite sure. I think that's a little bit outside of what I know, and with me not working with them, I'm not quite sure. So especially when you guys get into probably some of the other topic you have, you'd want to probably find that out more.
Well, it's good to know even that it might be.
Well, and I do want to say that Virginia Mason Franciscan Health, they offer through the actual Franciscan palliative and care, they have, through the medical director that runs their hospice and palliative care, they offer what they call a palliative care academy. You were talking about how primary providers and internal medicine and all them need to know about hospice. I actually did the palliative care academy when I worked for them. So they do offer that within their organization, and a lot of their doctors do take it. And it's a 2-day clinic that really teaches you on how to teach, or how to talk about, teaches providers how to talk about end of life and hospice services. Because honestly, I mean, if you think about it, most people did not go into medicine for end of life. They went into cure. So talking about end of life care, and if you don't work in it, is a totally different world. And it kind of takes a special skill to understand kind of how to talk about it. So they've created awesome resources out there to help inform, and they open that up to other organizations. So if our doctors wanted to get into it, there is that possibility of doing that. So there is some of that. I wish the outreach was a little bit more, but I think a lot of it is the doctor's time. You know, these doctors are overworked. A lot of them are overworked, especially right now. So yeah.
But that's in the Virginia Mason system, correct? That's what it's in the Virginia Mason system.
It is offered by them, but they do offer it. I know that they offer it to outside systems. Like any provider can take it. I think it's a fee if you don't work for Virginia Mason, but it's called the Palliative Care Academy. it was very eye-opening for me as somebody that works in end of life to take it, because I had people in there kind of from all walks of life and medicine, ER docs, it was different people within the hospital realm, like system. And they really, the end of life was not something they were comfortable talking about. So, and how to approach it, and the way that you're taught how to do it is just, it's a phenomenal.
Thank you.
Anyone else have a question?
So Lenny, I don't have a question, but I really want to thank Carrie. It was quite the adventure to get Carrie on board. And as she mentioned, she was basically at a tail end of an email chain and called me on Wednesday. And I thought she was a spammer, so I didn't answer my phone. So anyway, I really appreciate, Carrie, your time and flexibility. And I only sent her the Zoom information like a couple minutes before the meeting because I forgot. So she was very patient with me. So thank you so much, Carrie.
Absolutely. And I did see that you said something about the Long-Term Care Alliance. I do belong to that. So I do go on every meeting within Kitsap to really get to know the community. And I have to say, or I'm going to guess if you are over there, you all live in Kitsap County. I don't, but man, if I could, I would. I love it over there. I think the people over there are so genuine. It's just every time I've gone to a building and I've met anybody that's working in senior care in that area, they're very passionate about what they're doing. And they're very passionate about the community. So you guys have one great community over there. So I thank you guys for letting me come along and talk with you guys.
Catherine, you had a question? Unmute.
I just wondered if you have a list of doctors in Kitsap County which will go through the system and prescribe the end of life pill.
I don't. I think, honestly, I don't even know if there is. I think anybody would just, are you talking about kind of the death with dignity way? Is that what you're,
I'm talking about the death with dignity law.
Okay.
Law.
Yeah, that would be something that that's kind of out of my scope. I would say that most people would probably have to, there's probably their website and kind of go from there. So.
Mm-hmm. Well, and there's a real possibility that your primary care provider, or if you're in one of the specialty clinics for, they're going to have the resources to refer you. Mm-hmm. One thing that was in the Seattle Times recently, and you probably saw it, Pete Kreidler was one of ours. He lived out here and did not get information about his end of life choices and death with dignity from his primary care provider, who was with Franciscans. So we're all a little touchy on that subject. And we hope that's going to change, that it will become, like you, I think, probably would support this. Everybody needs to know all of their end of life options, no matter what your provider is willing to do. They should be able to refer you and to give the information. So that's one of the things that we hope to educate people about.
I think my understanding is once you actually like contact and get into the realm of death with dignity, and there's resources out there through a website that there is a lot of information, but it's kind of navigating and get to, and I mean, honestly, any type of healthcare system is hard to navigate. I'm so glad that I work in healthcare to be able to navigate my family through it. Right. I have a stepdad that's got some significant heart conditions, actually has an LVAD in, so he's very much in the Multicare system, because the only people that do LVAD is Multicare and UW. So being able to, I work in it and I have a hard time navigating through it. So that's, it's I'm very passionate about it. So I'm glad that I'm able to be a resource. Feel free, if you hear out there any bugs in your ear that people want more information on hospice, to pass along my information. Mm-hmm. I am more than happy to talk about hospice. I will send Jessica, just real quick, because I do have your email. I think I might have yours too, Lenny. Yeah. I will send over my PowerPoint that is really kind of touching on exactly what hospice is, the services, when to refer, kind of what it looks like. And it's really just kind of a hospice 101, but it's still very good information. So.
Right. Mhm. Well, we are going to have a program, a public outreach program in the spring. We're working on a date now, and our committee's going to talk about that a little more. But
Oh.
if you don't have any more questions right now, I will let everybody know that I did record this. I can't remember if all of you were on when I said that. So I will have this recording available to share with any and all of the healthcare committee members for sure, and also it will be available to other league members here in Kitsap. It'll be on our league website. So if there are no other questions, we'll let you go, Carrie. Thank you so
Okay,
much.
thank you. Thank
We'll be
you.
back in touch.
Bye.
Bye-bye.